A very good morning to you. Welcome to the discussion segment of Good Morning Anambra today. How are you? Sure you're good. I am too. So we bless God that we wake up strong. That's very important to many of us now because most of us go to bed hungry, not sure whether you're going to wake up. But if you do, you bless God and count the day. Okay, welcome. My name is Tijama, and today we're going to look at a very disturbing trend. Yes, I call it trend because it does appear. It's been around, but just recently it became very pronounced that people just drop anyhow. And I know I've also lost some friends like that on relation. You just slumped and die, and you keep wondering what's going on. Okay, some will tell you it's BP, low BP, some say low sugar, some say stress, some say a whole lot of things. But today, we brought an expert who should know to tell us exactly what could lead to this and what we need to watch to make sure that we don't slump and die. So that's the topic we're going to handle this morning, collapse and die syndrome, stopping the trend of sudden death. Okay, and my guest today is Dr. Pharmacist Okoye Oluebobe Miracle. Did I get your name right? Yeah. Okay, thank you. He is the resident doctor at Chukwuemeka Odumegwu Ojukwu University Teaching Hospital. And then there are other things that are attached to his name. He's also the MD Good Shepherd Children's Hospital in Pulobia. And then CEO, Myres Pharmaceuticals and the Stores. Did I get that, Myres? Okay. And then social media health content creator with media name Unusual doctor and the pharmacist. Okay. I'd like to welcome you to Good Morning Anambra studio this morning.
Yeah, good morning. It's nice to be here.
How are you?
I'm good.
You're too young for all these names attached to you. Like you started very early.
Yeah, kind of.
Okay. Now, you heard what to say we're going to look at, collapse and die syndrome. What does that mean?
All right. Collapse and die syndrome, as you said, it's something that is becoming so common and prevalent. You know, a lot of times, some persons just suddenly collapse, and the next thing, it's recorded that they are dead. And this is actually also called sudden death syndrome. When an individual suddenly collapses without any prior sign or symptom, you know, they don't anticipate that it's going to happen, and suddenly it happens to them. And under this context is actually divided. It has different contexts to that. There's what we call sudden cardiac death. That's when the heart suddenly stops working. You know, the heart dies. When the person has a heart attack, and at that point, the person can collapse and die. Then, secondly, there is also what we call sudden infant death syndrome. That's SCID. And in that situation is when an infant, that's a child from birth to 1 year, suddenly dies. And there's also what we call the sudden collapse syndrome. That's when somebody suddenly collapses, you know, from unexpected or some conditions that the person is not aware of. So these are the different contexts to the sudden death syndrome.
Scary. So it could also happen in infants?
Yes. In that situation, we call it sudden infant death syndrome.
That of the infant is not obanje.
No, not really.
Because that's what they used to call it. A child that would just die without a reason. They say, hey, then obanje will come in.
Yeah, these are the different myths that we have. People kind of, when they don't have explanation to certain things, they just attribute it to,
Okay, but I has been aware of living, because there's some that would notice that there was this period who came back from for Christmas celebration, and then after some time, people were rushing that somebody gave birth to a child, and they were rushing to go and see the baby. All of us went, like kids, to go and see the baby. And then when we got there, we discovered that there was stockings in the hand of the baby, and we were asking, no children, now we want to see the fingers. And then we later heard that the baby had died about 3 times, and while he was leaving the second one old woman chopped off his fingers. And
Wow.
he came back to life with a chopped fingers.
Wow.
Okay, so sometimes you can't just rule out some of these things from, you know, the way of life of a people. But that's by the way. Okay, so what is it that could make a baby slump and die, an infant between 1 to 12 months?
Okay, for an infant, it's not basically that they slump and die, because most times they don't walk yet. You know, and I think a majority of the cases, what parents usually discover is that their child, you know, who they believe was sleeping, and they suddenly come down and discover the child is no longer breathing. Yeah, and in some cases, it's been shown to be as a result of probably the sleeping position of that child. You know, that's why we usually encourage that a child should sleep supine. That's the face should be facing up, rather than facing as in the child sleeping with the face downwards. We usually advise that the child should be sleeping supine.
Is that new? Because when we were giving birth, it is the other way around.
Yeah, and that's actually why in some cases, you know, we discovered that that child may suddenly, that's one of the, you know, things that has been proposed to be one of the causes of that sudden infant death syndrome. Then it has also been shown that the kind of mattress that the child was laid on can also contribute. And that's why most times we encourage parents to let their child sleep on a firm mattress rather than a soft one. Because sometimes if probably the foam is kind of soft, it can, you know, push inward and that child can suffocate in the process. But if it's kind of firm and, you know, the child's body can rest adequately on that firm surface, and there are many other theories, yes, behind the sudden infant death syndrome.
Okay, we just brought that one in to buttress the point that we're trying to make now. Now, we have established that it's possible for people to just be walking on the road and slump and die, or sitting, as the case may. Let's use the latest incident that we had, that of the Onyeko Wenu, that she just finished performing, went and sat down and gulped a bottle of water and slumped. So what is the relationship between performance, sitting, gulping a bottle of water at the same time, and slumping? How can we fix that one?
Okay, no, there are a lot of theories or causes of sudden death syndrome. And most times, we've discovered in some cases, the individual usually have an underlying health condition. Okay, and in most cases, it may not be properly managed. For example, someone that is hypertensive and, which is not properly managed, and when there is an addition of stress to that, because stress is also one of the contributing factors to sudden death syndrome. When the person is undergoing excessive stress that is not well managed, the person is not well rested, the person is not, doesn't sleep very well, and when there are, accumulation of some of these contributory factors, it can actually result in, probably the heart overworking its function, or the person suddenly collapsing. So basically, there are many things. Most times, most incidents of sudden death syndrome are as a result of combination of several factors, maybe cardiac or something that has to do with the heart.
Now, I wanted to get these things together before we now look at the major cause of sudden death. So let's properly get into that now.
All right. Talking about the causes of sudden death syndrome or collapse and die syndrome, there are ones that is related to the heart. When I talked about the different contexts, I talked about the sudden cardiac death. And talking about the heart, you have conditions like heart attack. In medicine, we call it myocardial infarction. That's the heart suddenly stops working. And in that case, the person can suddenly collapse and die. Then there's also what we call cardiac arrhythmia. That's the beating of the heart is no longer the way it's supposed to be. That's normally, the heart has a pattern, a number of beats per minute. But in some cases, you may discover that the heart is beating excessively fast or excessively slow, all right, than it's supposed to be. We call it cardiac arrhythmia. And in that case, because of that disruption or dysregulation in the conduction of the heart, the beating of the heart, it can result in sudden death or sudden collapse. Then,
okay, what could, before you go further, what could make it beat faster and what could make it beat slower?
all right. Well, there are some disease conditions that can result in the excessive or abnormal beating of the heart. All right. And most times in some individuals that have some, those who are hypertensive, those who have some underlying disease condition, you know, that affect the heart and the blood vessel, okay, it can lead to that heart not pumping blood or not beating the way it's supposed to beat. And also some medications, some drugs that people take can result in some of these illicit drugs, you know, alcohol intake and the rest can result in the heart beating, you know, abnormally than it's supposed to.
What do you mean by illicit drugs? Local
not
drugs?
Illicit has to do with all this cocaine, our Igbo, and all those drugs that, you know, people abuse. You know, drug of abuse, that's what we call it. Marijuana and amphetamines and the rest that people abuse.
Local concussions?
Yes, obviously, it can. All those medications and the rest, it can
affect drugs.
Yes, it can affect. They can affect the hearts.
Okay, so go on. What
So
are the causes?
Also, talking about the cardiac causes of sudden death syndrome, we also have what we call cardiac tamponade. Tamponade has to do with accumulation of water or fluid in the heart. All right, the heart has different layers, and in some conditions, the person there can be accumulation of fluid in the layer of the heart where it's not supposed to be. And because of that, it can impinge, it can prevent the pumping action of the heart. Then also, there's what we call the embolism, pulmonary embolism. That's when there is blood clots. You know, probably people that have conditions where they have, we call it excess fats in the blood.
Is that the one they call cholesterol?
Yeah, when there is excess cholesterol, yeah, in the blood, it can lead to accumulation of blood clots, and that clot can go there and block any of the blood vessels that goes to the lungs, goes to the heart, and it can impinge that heart not functioning. It's more or less like attuned to, let's say, a car that has a fuel pump, or where the fuel enters the engine, and something happens and it blocks, you know, with the passage of that fuel. Obviously, you know, the engine wouldn't get, you know, the fuel to function, and that's why you see the engine of that car has knocked. So it also happens to the lungs, the heart, even to the brain. Then also, apart from the cardiac cause, there is also what we call the non-cardiac causes of sudden death syndrome. Something like stroke, right? That's a cerebrovascular accident. That's when the blood supply to the brain is affected. Either there is a bleeding into the brain, or there is blockage of the supply of blood to the brain. We can say that person has stroke. And one thing about stroke is that depending on the area of the brain that is affected, it can, if it affects the part that leads to the person walking or, you know, speaking, can now discover that that person is no longer making use of one part of the body. But it can affect the part of the body that is responsible for the beating of the heart, for breathing and the rest. At that point, that person can collapse there and die, because blood is no longer being supplied to that part of the brain that regulates the heartbeat, that regulates the respiratory function of the body. Then also have a seizure, that's what convulsion, epilepsy. All right, epilepsy is one of also another cause of sudden death syndrome. Then people that have disease conditions like diabetes, when it's not properly treated, some of the complications of diabetes, like we call it as what we call diabetic ketoacidosis. That is a complication of diabetes, especially when it's not properly treated. When the person don't treat the disease condition properly, it can lead to a condition that results in the sugar level of the blood becoming so high that it starts affecting the function of different organs and tissue. Then when the level of sugar in the blood is low, or called hypoglycemia. And this actually happens most time when the person is so much stressed. Maybe the person has been stressed for the day, has not taken time to eat, you know, from one activity to another and the rest. And at the end of the day, discover that the blood sugar is low. And if there is no sugar in the body, there is no energy. The body cannot produce energy to function. And if it becomes excess, it becomes very, very low, it can lead to the sudden death syndrome. Then in conditions where an individual is dehydrated, that's a loss of fluid, all right, especially maybe the person is undergoing strenuous exercise or during a very hot weather condition, and the person has been walking, sweating it out, and not taking enough time or not taking time to take fluid can lead to the person having dehydration. And if it gets very bad, that's what we call severe dehydration, can lead to shock, and that shock can lead to sudden death. Then there is some allergies. We call them anaphylaxis. When somebody is allergic to certain things, and there are levels to allergy. If the allergy becomes so excessive, there's what we call anaphylactic shock. When the allergy becomes so bad, the person reacts to a particular thing, and it becomes so bad, and before you know what is happening, it can contribute to one having the sudden death syndrome.
Allergy that could affect which part of the body?
Well, most times the allergy affects the skin, but it comes from the blood. Because what instigates the body to react to a particular thing is in the blood. And there are some chemicals that are there to fight when something that is foreign gets into the skin. The body reacts to that, and that reaction can be so much that, before you know what is happening, it can trigger a lot of cascades, reactions that can lead to a lot of things happening in the body. Then also trauma and injury can also be a cause of sudden death syndrome. We've seen it in a situation where someone maybe had an accident, and from there the person dies because of trauma to different parts of the body. Maybe the heart is traumatized, the lungs are traumatized, and in that condition, that person can die suddenly as a result of that trauma or injury that the person has encountered. Then I think there are also other factors.
Go ahead.
Yeah, there are also genetic or family history. It has been shown that individuals that have family history of sudden death are predisposed to having sudden death syndrome. And that's why we usually encourage, if you have a family member that suddenly collapses and dies, that we advise other family members to come screen themselves to find out
of what?
Of different
sudden death?
Of different things that can cause sudden death.
Oh.
All right. There is what we call the thickening of the heart muscle, for example. We call it the hypertrophic cardiomyopathy in medicine. That's the heart muscle becomes so thickened, and it's genetic. All right, yes. And because of that excessive thickening of the heart muscle, it's discovered that the heart doesn't relax enough well to pump enough blood to the body. And that's when we discover that maybe some persons that maybe they are athletes, they are sportsmen or women, we've had incidents of people that maybe they were running or playing football, suddenly they collapse and die. And if that person is discovered to have that particular condition, we advise the family members be screened to know if they also have similar condition. So family history is another factor that can lead to sudden death syndrome.
So is it the family history that will lead to somebody taking a walk and stop and die, or playing football or whatever? That one hasn't got anything to do with heart attack or what?
The point there is, as I said, there are many things that can cause sudden death syndrome. Okay. So if somebody discovered that a family member has suddenly collapsed and died, it's very important that the person is checked to find out if that particular thing that caused a family member to have such is also...
If they know what caused the other guy to slump and die.
Exactly. That's why most times we do autopsy and the rest.
Autopsy in Nigeria.
Yeah.
Okay.
Then also age is a factor. It's been shown that the risk of sudden death increases with age. Yes, it increases with age. Well, it's very straightforward because as one is getting older, the organs and tissues are no longer as optimal as they used to be.
They're getting weaker.
Yes, and that's why hypertension, diabetes, they are commoner in individuals that are on the quite elderly, because the function of the blood vessels, the heart, the pancreas, and the rest are no longer as optimal as they used to be. Then in some persons that also have underlying medical condition, maybe somebody has kidney problem, liver disease, and the rest, they can contribute to the person coming down with a sudden death syndrome. Then I've talked about the idea of medication. There are some drugs. There's what we call drug-drug interaction. Somebody is taking this particular medication, you also take another medication, without knowing that these two drugs can interact and cause harm to the body.
It's given to the person by a medical doctor now?
Well, most times, some of these people, they go out there and go and take over-the-counter medication.
Okay.
Our people now can always go there and buy any drug they have. Most times we operate a free open drug policy. People just go there, acquire any drug they have. They want. And
that's why most good pharmacists will always ask you, meet the pharmacist.
Exactly.
Before they can sell drugs to you. So tell the pharmacist what's wrong with you.
Exactly.
So you know the nature and the combination of drug that you can go with.
Yes.
Okay.
So that they can avoid interaction. There are some drugs that will tell you, okay, if you are taking this medication, don't take this one. Or take this one after some hours, take this particular drug. To avoid those interaction. Then I talked about the issue of substance abuse, both those that abuse drugs, marijuana, cocaine, heroin, amphetamine, some of these drugs that a lot of youths abuse these days. It can affect the heart, they can affect the lungs, even the brain, and they can lead to sudden death syndrome. Then sleep is also another important factor. Most persons don't sleep very well. I understand that people are trying to make ends meet. They're always awake. Sleepless nights added to stress, and there's what we call sleep apnea. One thing about sleep is that it's a way the body tries to, regain whatever its function. And most
whatever
times
it lost during the day.
Exactly. So when individuals don't sleep very well, people that have sleep disorder, insomnia, they don't sleep very well, it can lead to them coming down with that sudden death syndrome. Then nutritional deficiencies, poor diet, people that don't eat very well. When you don't eat well, the body don't get enough nutrients to function. And if they don't function very well, one organ or tissue can usually decide to pack because you are not giving the body what it needs to function very well. Then I also talked about the environment. We are in a very hot or warm environment, and most times it's very sunny, people are sweating, people are dehydrated, and most times people don't take out time to take fluids. Get yourself hydrated, take a lot of water to stay hydrated, and that's why sometimes it's called somebody is standing.
If you are dehydrated, apart from taking water, can you take something sugary?
Yes,
like
obviously you can take soft drinks, something that will just get you
replenish what's
exactly
going on.
Yeah.
Okay.
Very important.
Except the person is having a problem with his sugar level.
Yes. But fluid, plain water is the best.
Okay.
Make sure you are hydrated. So I think these are some of the things that...
Yeah, I think you have really lined out a whole lot of them, and then maybe getting some of us even scared. But we'll just have to talk about it, because that's nothing anybody can do without taking a good information and then making sure that you are well, okay? That's why we are here every morning, to bring out one expert or the other to let you know what you must do to be strong and live healthy, okay? Okay, we're going to take a break here. We're going to take a break because we spoke to some people while on the streets. We'll bring them in. After that, we'll come back and start looking at what we must do to prevent this. We'll just look at the causes. Okay.
Ọ dị nkanya bụ ihe esi na ụdịrị nri a na-erizi this time around. Oke nkuchikọ a na-akụchikọ nri a na-eri. Maka ihe n'anya in the olden days, somebody like oge nke my father nọ 92 years wee nwụ. Ifu na n'oge nke ha, nwere much ụmụ nri a na-akụchikọ ha package this time around. Ụmụ native food ka ha na-eri. Lichakwa anya and ahụ esie ha ike. Ha nọgide nọ ihe ha kwesịrị ịnọ, mana this time around a na-eme na anọ na new generation. A na-enwe lot of kind of food, ma ndị a na-akụchi ma ndị a na-esiri ma ọsịa ma nke a na-aṅụ aṅụ. Ụfọdụ some of them enweghị much quality. The producers achọkwughị ma if you eat and die, no consign them. Ihe ama a na-akpa ego. So if you know all this nri a na-erigasị, sokwa na-eme all this ọya na-anọkọta ọpụta, just like nke a na ha ekwu slump and die here and there. So n'ihe na-ekwu na anyị kwesịrị na-watch ụdị nri anyị na-eri, especially anyị na-agbagote na age. onye je check onwe ya ị ga check onwe ụmụ obere teknis anaghị erikebe ego ka mmadụ gara esi because of ego ma sugar level ma BP ma ọsị ha a na-echek ya from time to time because na ị nwere ike na-ene onwe gị anya feel ya na ide oke na-ede ndụ onye na-ekwu anya daha ata nothing mana you are dying inside yotago so regular medical check-up can I suggest.
The main cause should be people having low blood pressure. So many times people take drugs. People take drugs without adequate monitoring. So some people that have high blood pressure problem, that hypertension, you go to the medical people, they will only tell you, this one, take it once a day, without telling you that before you take it, you have to check your BP first of all. So in most cases, some people do not have much hypertension, but just little impulse. Their blood pressure might rise. So which they may need to take just small drug and it will come down. But then when they recommend more than is needed, then the person can just take it today. Maybe if you take it tomorrow, next tomorrow it will become low BP, and the person can easily slump and die. Most places, times, this is a wrong use of drugs. The way we can avoid this is that people. There was a time I recommended to some local government chairmen that they should distribute these kits for checking blood pressure in the villages a lot. Not necessarily people going to hospital. When they distribute them to villages, they have agents in each ward. So people can easily check their BP. Once it is, if it is normal, then they will not take any drug.
Well, I would say reduce stress, because too much stress can make you to collapse. Yes. Then also constant checkup. Once if you notice any differences in your body system, do well to go to the hospital to check out, because your health is supposed to be your priority.
You have to be self-contented. Stop thinking so much. Don't want to be instant millionaire and constant checkup. Make sure you check your body. You know, our people, we don't go to hospital. When someone have headache, you say, go and take Panadol or paracetamol instead of going for checkup. He or she will not do that. So that is what I am understanding from that side. And that is what causes so much BP. Somebody cannot fall and slump and die without having BP. I think that is the cause. So we have to be health conscious.
Through my recent findings, I can say that lack of sleep. I think medically they said we need to be having up to 7 to 8 hours of rest, of sleep, so that your body system will be fully active and all that. So not having enough rest, enough time for sleep. Then secondly, the second thing I have to say, I think I might just say these two things. Secondly is what we eat. We consume a lot of chemicals. Especially in this country, Nigeria, we consume a lot of chemicals. Many things are being produced. We just get into the market, we buy them, we just squander, we eat, use a lot of condiments. Our grandparents, I don't want to say our parents, let me say our grandparents, they don't used to fall and die. But this falling and dying stuff is what we are seeing now. And I feel it's as a result of part of it is as a result of what we eat or we drink a lot of gas, we taking a lot of chemicals and all that. So I think these two things are the things I have in mind that are part of the things that we look into. Eat more of healthy foods.
Okay, welcome back. It is still Good Morning, Anambra. And we're looking at the topic, sudden death. How can somebody will just sit down and before you know it, the person slumps and die. That's why we said, let's get a doctor to look at it. And the doctor that is with me in the house is Dr. Pharmacist Okoye Oluebube. Miracle. I still welcome you to the house.
Yeah, thank you.
Okay. And then it does appear that those people that were talked on the streets are all medical doctors because they were all talking like professionals. Okay, and that added color to the whole thing. Thank you very much. Thank you. Okay, let's now, we have looked at different things or different ways that this kind of thing could happen. Let's now look at the prevention. What must we do, Dr. Oluebube, what must we do to prevent sudden death?
All right, talking about prevention of sudden death. First of all, talking about prevention, we must identify the risk factor to that. If one has a risk factor to sudden death, for example, an individual that has heart condition, that is hypertensive, that is diabetic, someone that has a particular risk factor for any of these causes that we talked about, it's important that they are identified and something is done about them. Then also the importance of medical screening. The person that talked about the importance of going to the hospital for medical checkup. Because most times we discover that our people, we shy away from hospitals. We feel that hospital is a place you go only when you are sick. Rarely do you see people walk into the hospital to go there, to go screen themselves. Go check your blood pressure, check your blood sugar, look at your kidney, look at your liver, look at your cholesterol level. Most persons, they get to the hospital only when it becomes very bad. When the condition, has become, it has deteriorated, it has become so bad, that's when they get to the hospital. So that's why it's very important that one undergoes regular medical screening and checkup. Go check yourself in the hospital. Then there's also what we call lifestyle modification. All right, the importance of modifying our lifestyle. When it comes to, somebody talked about the issue of stress. If you know that you are always very stressed, it's important to make out time to rest. Because I used to tell people that when you die, life will continue. It wouldn't wait for you, and maybe life will not stand still because you are no more. So it's important that you make out time to rest, give yourself rest, give yourself vacation, so that you can relax and get your body functioning properly. Then diet is very important. Somebody talked about the food we eat. Most times, a lot of persons consume a lot of junks, food that don't have much nutritional value. And if you're not giving your body what it needs to function, obviously you don't expect it to function optimally. So the importance of modifying our lifestyle cannot be overemphasized. Then the idea of exercise is important. Some persons live sedentary lifestyle, from office, they stay in one place, get to their house, stay in one place, and the rest. It's important to make our time to exercise. Then also, still talking about exercise should be regulated. I talked about maybe athletes or sports persons suddenly collapsing and dying as a result of maybe having an underlying heart condition. Because there are some persons that they are predisposed because of the genetic factor, the way their heart is. The heart cannot be able to accommodate some level of exercise. Mm-hmm. So that's why before you undergo some strenuous exercises, you check and be sure that your heart is functioning properly. Then the next thing is the importance of awareness and education, and that's what the importance of what we are doing now cannot be overemphasized. Let people be aware. Awareness education is important. If people don't know that this thing exists, that somebody can suddenly collapse and die as a result of some underlying medical condition, they will not know. So it's important that we go there, educate people, let them know. Our parents, our relatives, our friends, they should be aware that they have to be careful about their body, go for a regular medical checkup, eat very well, screen themselves in order to avoid some of these things. Then I also say the importance of emergency response. Because assuming somebody collapsed and died, what do you do? That's the question. That the person suddenly collapsed and died.
Oh, the person suddenly collapsed.
Collapsed,
so
yes.
What do we do to ensure that the person doesn't die?
Exactly. Okay. That's why the importance of emergency response. Most people don't know that even in Anambra here, we have an emergency response number. You dial 911, somebody is over there, they'll pick up, and an ambulance will arrive there as soon as possible and take the person to the hospital. And with what the government has done, the person is entitled to 2 days free treatment without pay. That's
if he's still alive.
Exactly. So if you discover that maybe somebody, you have an emergency, you can always, call that emergency number. But before then, the importance of
every emergency case or just somebody that's slumped?
Medical emergency case, every emergency case.
Every emergency case.
That's what we call emergency response.
You have 2 days free medical treatment.
2 days free medical treatment is obtainable here in Anambra State, but many people don't know about that.
We need to know this,
Yes.
that in every emergency case in Anambra State, you have 2 days free medical treatment.
Once you call that number, the
are
ambulance
we good on
comes.
this?
Yes.
Are we good on this, medical doctor?
Yes.
When did it start?
It's been there for, I think, since last year or thereabouts.
Okay, and a lot of people do not know about
Exactly.
it.
You call the ambulance, that 911, somebody is over there.
Are there hospitals that are attached to this?
Yes.
Particular? So which hospital can we go if we have such problems?
No, most times is when the ambulance comes, pick you up and take you there. It's not like you have to walk in there.
Take you to the hospital?
Yes.
Okay.
Once there is an emergency, you call the number, and the ambulance comes around, pick you up, take you to that hospital. There are different accredited hospitals that can handle that.
Okay, it's the ambulance that knows that. What if there's a standby vehicle to take that person to the hospital?
Well, the most important thing is to get the person
to the hospital.
Yes.
That's what I'm saying. Which hospitals can we get this kind of services from?
Well, I wouldn't know the other details around it, but
okay.
the one I'm so sure about is the fact that once the ambulance come, pick you up, they will take you to any of those accredited hospitals to take care of that. Okay. Then the importance of CPR, that's first aid. Okay. Before the ambulance comes, you should be doing something. You shouldn't fold your hands and do nothing and wait for an ambulance to come. You should start what we call CPR, that's cardiopulmonary resuscitation. I know I talked about it in my YouTube channel about the importance of CPR, that you start doing cardiac massage, all right? And it's very important that everybody knows how to do that cardiopulmonary resuscitation. Okay. You start pumping the heart. It's more or less like I used to call it jump-starting the heart. Let's say you are driving and suddenly the battery to your car stops functioning. You need another battery to help the battery to start again. So that's where the importance of CPR cannot be overemphasized. Before the ambulance comes, you are there to start compressing the heart, start giving mouth-to-mouth breathing. And that way, you can help the heart to start functioning again, pending when the emergency response comes into play. So the importance of CPR, the importance of first aid, cannot be overemphasized. Then there's also what we call the external manual defibrillator. And it's usually advised that most public places, most organizations should have that and the individual should be taught on how to make use of them. Mm-hmm. All right, and so that when somebody suddenly collapses, if you have such in your facility, you can pick it up and use it to help the heart again. That we call it external manual defibrillator.
Can I pick it?
No, it's actually sold. And that's why I said,
one can buy it.
Yes, we encourage that facilities, organizations should have it and keep it at their place of work, so that and people should be taught on how to make use of the external defibrillator. Then I talked about the importance of cardiac screening. It's important to screen individuals and families for people that have the sudden cardiac death. Screen families, importance of sleep practices. I talked about sleep practices. Then when you have any chronic condition, it's important to manage them. Some persons are hypertensive, they are diabetic, but they don't take their medications. Most times they will tell you that they have this condition and they took their drugs for 1 or 2 times and they stopped. And in some cases, you meet those people and their blood pressure becomes very, very high. It can get up to, I've seen cases of 200 and something over 150. And this is what we call walking corpse. The person is walking, but the person can collapse at any moment because of such a high level of blood pressure. That's why it's important. You have any medical condition, chronic medical condition, you keep managing them. Keep making sure that they are under control. Then the importance of stress management. Our people, we are stressed. I understand that people are trying to make ends meet. They are trying to, the economy, they are trying to just make sure that they put food on the table of the family. But it's important to manage stress. After being stressed, take out time to rest. Take out time to take a vacation. Take out time to have some period of relaxation, so that you can get your body functioning properly again. Then family awareness. I talked about health awareness, publicity, getting people to know about the importance of keeping healthy, keeping their body fit, and also the issue of being hydrated, that's electrolyte imbalance. When you are stressed, when you are sweating too much, it's important to take fluid. Make sure you are always hydrated. You know, don't allow yourself to get so much stress. You are sweating. The next thing, and it's called that most times when you are excessively you've sweated so much, it's called that you start having headache. And that headache may be as a result of fluid that you've lost. That the body is functioning under lower amount of fluid or water. Yes, that is supposed to.
So at that moment, all you need is just to drink water.
Yes, take a bottle of water and drink. And most times you discover that you feel okay, you feel fine because you've hydrated yourself properly. Then for individuals, we're encouraged to avoid stimulants, some of these illicit drugs. You know, a lot of young persons abuse these drugs, but don't know that they are doing so much more harm than good to the body. It's important to avoid stimulants, illicit drugs. You know,
what about drinks like alcoholic drinks, wine, beer, and all those ones?
Exactly, it's also a factor.
Part of the whole thing?
Especially when people
you have
take
told them to take their time and relax and enjoy themselves. So what do they enjoy with?
Enjoy in moderation.
Enjoy a bottle of wine, whiskey, brandy, beer, and all those ones to, you know, bring up your spirits.
Yeah, we encourage people to do those things in moderation.
Okay.
Yes, moderation is very important. Don't just get, you take alcohol binge because it's available. You keep drinking and drinking and drinking. Obviously,
especially
it affects.
When it is free.
Yes, exactly. So I think these are some of the things that we could do to prevent the sudden death.
Thank you very much. I want to ask you a question now because we're running off. I read somewhere that if at the onset of a heart attack, there could be signs that would have run for 1 month, 3 weeks, 2 weeks, showing you that this thing is coming. Okay, in the case of sudden death that is not caused by heart attack, is there any kind of signs that you will get that you might be facing a sudden drop, you know?
All right, the sign actually depends on what is causing the sudden death. All right, for things that has to do with, let's say, the heart, or the lungs, you discover that the person may discover that he's becoming drowsy, he has been feeling dizzy for a while, he's always tired, you know, he's breathing so fast, you know, the person is no longer coordinating as he used to be. You discover that your body will give you certain signs. That is not the way my body has been functioning, it's no longer functioning appropriately. So the different symptoms or signs depends on the condition that may trigger it.
Okay.
Yeah.
So when you notice such signs, what do you do?
What you do is to obviously go and seek medical attention to know how to manage it.
Okay. Thank you very much. Now advise the people on how best to live your life to avoid sudden death.
Yeah, it's very important. As we said, it's becoming common. Sudden death, people just collapse and die. And that's why it's very important to know about your body. Be sure that whenever you discover any abnormal sign, symptom, or you have any medical condition that you are managing, it's important to go seek medical attention. Make sure you live healthy, stay healthy. You know, if something happens to you today, the world will still go on. So it's important to stay healthy and stay fit.
Okay. Very, very important to stay healthy and stay fit. This is on this note, we are drawing cutting to this morning or this week's edition of Good Morning Anambra, because we're going to see you again Monday. And I'd like to thank you very much for finding time to join us this morning, Dr. Pharmacist Okoye Oluwabobe Miracle.
Yeah,
thank
pleasure.
you very much for coming. Yeah, and you are the resident doctor at Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Oka, and he's also the MD Good Shepherd Children's Hospital, Ikulobia, CEO Myres Pharmaceuticals and Stores. And finally, he's a social media health content creator with media name at unusualdoc.farm. You're a pharmacist, you're a medical doctor?
Yes, I am. But
you started sweating, like I said. So thank you very much for coming today.
My pleasure.
All right.
Welcome.
Okay, thank you guys that are in the house. Ekumog, that's leading the camera guys this morning. And then who is behind there? The MCR guys, thank you very much for making this happen today. Thank you, Chinyere Oreki, that led the production team this morning. My makeup artist, Tochi, a whole lot of them that made it happen this week. I'd like to thank you and ask you to stay safe go check your health to ensure that you are in top form before we rejig and come back for Monday. Thank you very much for coming. My name is Sijoma Uche on behalf of the Good Morning Anambra team led by Ifi Unachupu. I thank you for joining us this week. Bye for now.